NPAFInc today on 2nd of November 2024. We have come up with one more faculty from India. We were waiting we continue to receive a lot of requests from all over the world to
वडिशः
participate in our shows and to make their voice heard, but we were looking for the
काप्यकात्यायनावुभौ
right faculty that can help us to make value
काङ्कायनः
addition, and we have Dr.
कैकशेयो
Sunita Chaudhary
धौम्यो
with us from Pune. She
मारीचकाश्यपौ
is an eminent scholar in the branch
शर्कराक्षो
of Ayurvedic medicine, a
हिरण्याक्षो
global traveler,
लोकाक्षः
and
पैङ्गिरेव
it's an
च
auspicious day to welcome her on the
शौनकः
platform of NPFInc.
शाकुनीयश्च
We are setting up the
मैत्रेयो
scenes
मयिमतायनिः
on all the network. Bandwidth transmissions are in progress, and in next 1 hour or so, we will have Dr. Sunita with us today from India. She is a global traveler. She coaches yoga all over the world. She travels. She has a good network, very good reputation, good understanding, and incidentally, she happens to be a scholar of my senior scholar from another institute from India. So we are very proud to have her today. Uh, Next half an hour, she will be speaking to the network of NPFInc on different aspects of healthcare. And after the presentation is over, we will take some question and answer if you have any. And a big happy new year to all of you back home in India. It's a Hindu New Year, and what can be and what can be a better day than that of making a presentation on a Happy New Year of of the Hindu religion where we are belong to. So thank you, Dr. Sunita, for making it convenient and giving us a time today. We are truly honored and blessed. Floor is yours. I want you to take the presentation forward. We will be listening, and as soon as the presentation is over, we will come back with more question and answer. Over to you, Dr. Sunita.
Thank you, Dr. Pranav. Namaste to all, and thanks for having me for this wonderful occasion. So let me share my presentation first so that we can go over this subject. Is it visible?
Yeah, perfectly fine.
Yeah, perfect. Yeah, okay, that's fine. Yeah. So namaste to all once again. I'm Dr. Sunita Chaudhari, as Dr. Pranav have already introduced me. I'm Ayurveda doctor and yoga masters, so integrating Ayurveda and yoga in my practice from 30 years. So today is an auspicious day, and we are having just recently Dhanwantari day, that is Lord Dhanwantari, god of Ayurveda, or we can say Ayurvedic medicine, and we just celebrated his birthday, that is Dhanwantari Jayanti. So we'll just think about the health, and that is also special segment, that is women. So our one of the most better half in everybody's life. So we will see the Ayurvedic lifestyle for women health and wellness in current era. So why Ayurveda means, how Ayurveda could be helpful in current era, what women health issues and women are going through their health problems, and how yoga and Ayurveda are still be useful as they are practiced since 3000 years. So this old 3000-year-old science, how it could be helpful in this current era. So technology era, modern era, new generation era. So how this old traditional science could be helpful. So this curiosity and this question usually being asked to me, as whenever I travel to teach Ayurveda and yoga around the globe. And when we put the two sciences together, like ancient uh, medical science or health science from India and modern health science together, and we see their concepts and the fundamentals, and we study closely, we can see there are so many uh, gaps could be bridged, or so we can take the all the good part of it, and whenever we are not many researches are going on currently, so we can always use this wonderful science uh, as our lifestyle. So Ayurvedic lifestyle encompasses many different things. But what we can see here in this picture, we can see a clock. So it's a rhythm, some kind of cycle. So many things are explained in one single picture. So how it is very correlated, like our lifestyle, or whether it is a urban area or rural area, wherever you are staying, you are following some kind of lifestyle in your life, and you are following that routine and following all those things in your life, whether it is your food habits, whether it is your day-to-day routine habits like sleep, diet, and all other activities, your behavioral pattern, your thought process, your thinking pattern, everything is related and everything encompasses in the lifestyle. And this is how we are encompassing all these factors in wellness as well. When we see the wellness as Ayurveda and yoga as a wellness. So this is age-old science which has explained this cycle or rhythm. We can say it's a circadian rhythm, circadian cycle, which currently everybody knows about this circadian cycle and how it is. It has won the Nobel Prize, but this was explained in maybe in a primitive manner in Ayurvedic textbooks, or maybe we are short of decoding that language because it was explained in Sanskrit language. But definitely, when we read through the all those Sanskrit manuscripts, it says that this cycle is very important and all our body functions, body systems, they are all following this clock or our biological clock in some rhythm, some cycle. And it is as per the dinacharya and rutucharya, that is how in our nature we are following as a uh, our day and night. So isn't it very fast means correlated in current era as well. So how they have explained as this Ayurvedic lifestyle practices in Ayurveda and yogic textbooks. Uh, so it is said as a code of conduct or pathya. And so before this priority explaining this, they have mentioned the, how the person could be uh, could be seen as a healthy person or having a healthy lifestyle. So health has been described as a swastha. That means every body system is functioning at its own natural rhythm, that is swastha. So they have explained in Sanskrit like swasthasya swastha rakshanam aturasya vikara prashamanam cha. So this is a Sanskrit shloka we find when we talk about the Ayurveda, Ayurvedic lifestyle and health as a definition. And they have given even different definitions for health. What are the factors encompassing your health when you uh, see the health as in a whole body or as a system? So that encompasses dosha, dhatu, mala. That means the three basic elements in our body. That is dosha, dhatu. Those are body tissues. Mala, they are excretory excretions from our body. They should also be in balance. Then Agni, that is a digestive fire and other metabolic functions happening because of the transmission or transformation, whatever inputs we are taking in our body, like food, our thoughts, everything getting synthesized in our body, and that uh, as a digestion, they have called as a digestion. So you can see as a metabolism. in our body. And the mind also has been given the equal importance in this definition of the health. So, mind, body, and spirit, these are the three components they have tried to cover in as a healthy body. They should be in a balanced state. This is what they call as a swastha. And this balanced state will be maintained when we are following this lifestyle. So dinacharya, ritucharya. So charya, that means whatever routine we are following, it is called the lifestyle. So day and night, whatever regime we have to follow as per our natural environment, geological uh, place where we are currently, and whatever the available resources of food uh, as per the season. So it is called as a ritucharya, that means seasonal regimen. So this uh, encompasses all different our day-to-day activities, like how we move, how you think when you are working, your behavioral patterns, everything, as day and during the day and during the night. They also emphasized on this tripod of the health, like diet, sleep, and sexual health. It is called as a brahmacharya, but when you uh, transcribe that word, it becomes a sexual health. It's not only the sex. So that also they have encompassed in this particular uh, explanation of our lifestyle and behavioral code of conduct. It is called as a achara rasayana. So all these factors together, when whatever they have explained in those Sanskrit manuscripts, uh, called as a lifestyle, and how these are applicable to our current era, our day-to-day life. So when you see whatever, nothing has changed, our day and night has not changed. We still have day and night. 3,000 years before also we are having the day and night cycle. It has not changed. It also having a sun and moon uh, factor involved in that when you say that. So as per the metaphysical explanation, and how it is affecting our bodily function as a hormonal balances. So all different axes in our body. So how it is uh, making impact on our body, and when we are following particular cycle and we are following that cycle naturally, so then it is helpful to maintain our health, and that is what becomes the lifestyle. So this just now I have explained, and they have nicely explained regarding the uh, pathya, that means the diet. So diet has been given a utmost importance because that is the input which we are taking uh, without fail. Sometimes we feel that whether we are living for eating different kind of foods or uh, testing that our taste buds. This is what just a joke, but this is how we behave sometime, and our health hampers because of that our mindset or that our behavior regarding the food. So when we are not mindful regarding your food, this happens. So why, what they said, it's very nice proverb in Ayurveda. They say पथ्ये सति गदार्थस्य किम औषधम निषेवनम, and पथ्ये सति गदार्थस्य किम औषधम निषेवनम. So it may be same shloka, but it has a different meaning. Like when diet is wrong, medicine of no use, and when diet is correct, medicine has no need. So this is what this Sanskrit proverb we can translate in, and it is correct when we see that when we follow the diet, most of the problem get rid of the problems, most of the problems, when our dietary habits we change, or if we don't have the proper dietary habit and we try to change them, we can feel the changes in our health. So this diet concept has been nicely explained in Ayurveda with all the food items, whether it is vegetarian, non-vegetarian, on all sort of food items. Then appetite digestive fire and metabolic fire, and prakriti concept and compatibility. So as per your body's prakriti, that means your nature of your body, and the nature of the food, if it is not compatible, then you will have the problem. Then the compatibility of the two food items, so interrelation of the food chemistry. For example, if you are eating milk with very sour fruits like uh, kiwi or something like that, and if you mix together and make a smoothie, then as per Ayurveda it is not compatible, because of the properties, and the taste is also not compatible as per Ayurveda. So sweet and sour taste, when we put together, it is not compatible, and it creates some health issues in body. This is how Ayurveda says. This is a one research top. This could be a research topic, uh, but they have given the elaborate explanation about this incompatibility and how the disease formation happens. So this is also we are encompassing in our lifestyle. So this is how our lifestyle currently regarding the food, our food habits and food behavior. Most of the time it is food delivery and how we are indulging the food items and our savoring our taste buds. So major aspect to the food. Then sleep has been given the another equal importance as a tripod, and it is we can feel when as our sleeping patterns as our current our working patterns has changed, and most of the time, as we are talking about the women health, and we now see how women are busy in their career and home and work and home balance, work life balance, and their family life balance or their personal life balance, and how they are hampering their resting phase during the day or night. Sleep is mostly hampered, so it is very important, and how it is affecting our mind. So we know that, so that is why they said we should have adequate amount of sleep to repair wear and tear of the body tissues. It will give the calmness in the mind and relieve fatigue and many different kind of mental calmness, and then you will feel the different benefits of the sleep as for your mind and body balance. And then sexual health is also given that one of the tripod, it's given the importance. So how this suppresses our mind and our feelings and our all other emotional imbalances, and our hormonal imbalances if the this health is not being taken care. So that is why they have given its importance, especially for the woman health, because women health, we will see in our next slides how it is important. So basically mind and body, direct impact on our mind and body. So how this integration happens, Ayurveda and yoga integration for physical, mental and spiritual health. So we will just keep aside the spiritual part. We are not going into the metaphysical, but we will just talk about the physical and mental level, how it is helpful, Ayurveda and yoga. And for that, they have given a number of remedies and recommendations how to come over all these health issues. Recommended like Ayurvedic therapies, Abhyanga massage, like herbal steam fermentation, Nasya, Shirodhara. Uh, so Nasya is a nasal drops. Shirodhara is a pouring of liquids on your forehead. Mainly oil or milk is used, and but different decoctions are also used. Then basti, that is medicated enema. So these are the uh, mostly used therapies, Ayurvedic therapies, when we are talking about the women health and the wellness as well. So this is how we can see, these are the pictures which we are doing in our therapy center. So all these therapies are being done for the woman health. Like this is a Abhyangam like massage. You can see the body from head to toe. We are giving the massage. Then this is nasal drops, and this is some kind of joint pain or joint related health. We are using this kind of therapies. It is also called external basti, and these are the potally. These are all kind of massages. We can include all these in the massage and fomentation treatments, and this is a leech therapy, uh, and many more therapies like I have earlier mentioned, basti treatment and all that, basti therapy and all that. So we already seen the circadian cycle. Ayurvedic clock represents the Vata Pitta Kapha cycle in that circadian rhythm. So how these three doshas rotate in the uh, cycle as a clock during the day and during the night. So this is how it is explained here. Like during the day, this is when the day afternoon from around 10 to 2 p.m. It is a Pitta period. Then 2 to 6, it is a Vata period, and 6 to 10, it is a Kapha period. Then again in the midnight, it is a Pitta period. Again in early morning, it is a Vata period, and from 6 to 10, it is a Kapha period. So this is how the this dosha clocks uh, has a cycle in our body, and this is how they are functioning in our body as day and night as a cycle. And it is in a rhythmic clock, and we have to follow to have a healthy our health intact. So, according to this, if we follow the food habits and all our work schedule, then it will be more helpful. So, how we can see that, like the during the day, when it's a daylight, when the sun is there, your digestive fire is good, so you are able to digest food. Uh, and when the sun is not there, that means the evening to the night period, so that time the digestive fire is less or diminished, and if you have the indulge in a heavy to digest food, it may not be digested properly. So this is how they have given that as a thumb rule for our eating food habit. So there are these are some fundamental rules. If we follow, then also we can see the differences in our day-to-day life. Also, if we indulge in a very heavy to digest food, for example, uh, red meat, or maybe uh, it's really takes a lot of time to digest, and if you eat in the night, so it takes a lot of time to digest, and especially you are eating in the day, it's during the night time, so it takes a lot of time to digest again in the morning and in complete clock cycle. So this is how they have tried to explain how this Ayurvedic clocks function in our body. So this clock function in our body in women, especially, more we can see the its presence as woman has changes in her body from childhood to the older age. This is how the changes can be seen and felt. So primarily when we are seeing the woman body changes. So the childhood till the menarche, so one phase, and then menarche to puberty, and this puberty age for pregnancy, postpartum period is also there. Then after that menopause means this reproductive phase. After that menopause phase. So these are the so many phases and changes in a woman body, and hormonal rhythm as per we have seen as per the clock. So this rhythm is has also fall in place and has to be maintained. If we are having this kind of lifestyle continuously, changing of the our times, the eating or our sleeping patterns, and all those things are continuously changing, then this body cycle and rhythms may be disturbed. So this is one emphasize point they have. Ayurveda and yoga have tried to explain in the everywhere. So balance is the key. This is what they have already said. Sama is a balance. So this is how they have explained. Samadosha, Samagnisha, Samadhatu Malakriya. This is the one explanation the Sushruta has given as an importance for the Samastiti, that is a balancing act of all our habits and all our day-to-day lifestyle. And then how we can see the woman's life. Uh, so how the young woman uh, facing all these different kind of, this is our current healthcare scenario, and how she has to undergo all these kind of things, and she should be aware of all these things to have a good health, to maintain her good health. I This is a long list. I will not read everything, but we can see there is a long list, and I'll just mention a few things like when we are talking about the young adolescent or young girls or women, uh, main focus is on the HPV vaccination, menstrual health, sexual health, pregnancy care, mental health, management of long-term conditions, and pelvic health. So the middle years, these are the reproductive years mainly. They are for the sexual health and menstrual health related to fertility. Then cervical screening, pregnancy care, mental health is also given more importance. And the later age, obviously menopause and sexual health and cancer screening. These are the major healthcare scenarios as we can see. And as the WHO also has given the emphasis on uh, these factors, as they are uh, causing the NCDs, that is a non-communicable diseases, and that burden is more nowadays. And this is what WHO has also mentioned in their reports. So 7 in every 10 death worldwide because of the NCDs, and all these are lifestyle related diseases. They are called NCDs, and these are the burdens which they are feeling, like heart disease, cancer, stroke, osteoporosis, dementia, menopause, and concerns of young women. So majorly the cardiovascular diseases, chronic respiratory diseases, cancer, diabetes, and mental health condition. So WHO has also given all this are very important, and they have targeted to come over these problems and how to come over. That is the uh, thing. So, how this can be taken care by Ayurveda and yoga? So, what is the Ayurvedic perspective when we talk about the woman health? So when we are talking about the woman health, now we saw there are three phases in woman health. That is a majorly we can categorize. Uh, uh, so like childhood till the puberty is a kapha predominance period, and that is a growing phase. So we can see the more nourishment and growth is there. And reproductive age, when it is a middle age, it is a more pitta predominance period. So it's a more movements are there, more metabolism is used. And then menopause, that is the vata predominant period. So vata is responsible for aging in that case, we can say. So these all vata pitta kapha, if there are these doshas as having a dominance uh, in a natural way. And so these are the natural predominance as per the age, especially in women's life, as per Ayurveda. And if we try to maintain all these doshas in that particular period, then the womanhood, the woman's health will be a more smooth journey of having the roller coaster of the hormonal changes every now and then. So this was the main uh, focus when they explain all these things in their books. We really, Ayurveda have many books written in Sanskrit language, and especially they have given emphasis. Maybe the Sanskrit, because of the Sanskrit language, everybody is not able to read, but when we transcribe it, it is says like this. So this transition of the dosha dominance is depend upon lifestyle and genetics, as per Ayurveda. So Prakriti plays the role and health conditions. So, uh, uh, like for children in the child phase, the how the different health conditions like more respiratory or maybe more tonsillitis or cold cough kind of things we can see in the childhood phase. And reproductive phase, like it is pitta predominance, and we can see the more pitta predominance conditions in this phase, like hyperacidity or maybe GERD or different kind of things which are pitta predominant, like health condition we can see majorly even some kind of menstrual cycle related problems as well can be seen in this age more. Then menopause also, it's a more vata, and we can see the osteoporosis or joint pain related, that is a vata governing factor. So it's related health conditions we can see more in this phase of life of the woman. So how we are seeing this as woman health in a puberty age is like skin and hormones are mainly seen, like any teenager you can see the anxious about her acne. So that is a major focus of any girl. So she will always ask me as an Ayurvedic doctor, uh, that she's facing this acne and she want to have a very reddened skin. Without having acne marks on the skin. So all these things we can see. So these are the because of the hormonal changes happens in her body from the transition of the hormones, uh, and like a girl becoming a woman. So these are going to happen for most of the teenage girls. It's rarely seen that not having acne in this transition period. Most of the girls have to go, but the intensity may be less or more as per her lifestyle, food habits, and all these lifestyle habits and her genetical code. So this skin is mainly focused. So the acne, when we see the acne, so it's a kapha predominant, like sebum production is more, then hormonal changes, and body is going into the transition towards the reproductive age. The acne is also having a two kind of acne, like they are just skin pores are clogged with some makeup material or something, and then there is acne formation. And second is with a cluster of pustules and pimples with hard pustules, and they are very painful, and they are every prior to her menstrual cycle she is having more and more acne. So this is more related to the hormonal uh, acne, and this has to be addressed with the both the things. So not only focusing on the skin, but the hormones as a menstrual cycle. And PMS is another thing. So how what acne we can address with herbs like kumari, like aloe vera, or manjishta is another herb which helpful for the acne as a skin mm, and blood purifier. So the Ayurveda has given as a blood purifier. That means it works on your hormones through the blood. So this is how the I'm not going into the detailed treatment of the this acne, but just mentioning whichever is just a remedy or recommendation which can be used generally. If anybody has any problem, serious problem, they can always or visit their doctors, and under the doctors or Ayurveda doctors guidance they can take the further herbs or herbal supplements. And these Two herbs can be used as an external and internal application as well. Like externally also it can be applied, aloe vera gel or manjista kind of things, or turmeric. Uh, so it gives a good results. Then coming to the PMS, that is a premenstrual syndrome, like cramps or premenstrual cycle period time. Uh, they are feeling the cramps and the lower abdominal pain mainly. So these are the two major symptoms in this PMS, and this is a more of towards the Vata uh, predominance, and we can advise them to uh, having some hot water bath fermentation or apply application of the oil on the lower abdomen, and herbs like aloe vera. Aloe vera is a very uniquely explained in Ayurveda is called as a Kumari. So Kumari is a Sanskrit name for the girl, and so any health issues related to the woman's health, especially menstruation related, this herb is very useful. So aloe vera could be used everywhere. So, what should be avoided in this period, especially? So, in acne, we know that general health avoidance like fatty food, or complex fats like fried food items, especially, and then avoiding uh, any other those who are junk food kind of things, so which can hamper their overall digestion, and then giving trigger to the acne and triggering as a factor to other systems. Then inactivity like not doing any exercises, uh, sitting or job, or not making much movements of your body, that is another thing. And obesity, these are the another things which we can address with some exercises and yoga, especially yoga, some asana which are very helpful, which are having a whole body involvement, a movement, and pranayama and meditation. So mind and body togetherly we have to consider when giving or addressing all the health elements. So what are the phase of the life, uh, sorry, so this is how the yoga we can explain to asana. Surya namaskara, this is a flow of 12 steps surya namaskara, and there are different postures you can see being performed in a uh, rhythmic manner or stepwise. Uh, and these different postures are helpful all the body movements and all the extremities as well, and giving all body whole body exercise, uh, and hence it is useful for especially young teenager women if they do in a little bit faster pace, so to have the good effect on their system. And pranayama, we can see the anuloma viloma, that is a alternate nose breathing is recommended for this condition, which will calm down their systems and the mind, and bring balance into sympathetic and parasympathetic tone. Sorry. Yeah. So, modern woman, now we are going to the next phase of the life of the woman, that is a reproductive phase. And modern woman, we can see always multitasker, and how she's doing many different tasks at the same time and tries to do all these things as a smart woman of the new generation X. So, how we can see this picture, she is having so many different like laptop and working at the one side, and all her mind is going into the what to prepare for the lunch or dinner, or how to take care of my baby, and how to attend that social event, or how to attend that phone call, or I have to make a phone call somewhere, and also the traveling and so many things. Even has to take care of her own fitness, so attending gym or some activities. So she is a complete multitasker and without rest. And see how she looks like as a Indian goddess Durga to me, who's having a different weapons in her hand and ready for the battle. So this is how the new era woman, uh, ready for the battle, always flight and fight mode, doing so many things and putting her systems on the stress, and going through the different kind of health issues. So this is modern woman in current era, and we cannot avoid all these things from doing it if you have to survive. Also, how to take care of ourselves, women. So reproductive phase, most active phase of the woman, like career, marriage, children, multitasking, and all balancing act on the work-life balance. So it's a pitta predominance period, and because of that, uh, always having flight and flight mode. So all our hormonal cycles in the body, HPO axis and HPA axis, they are in the always balancing act. And if they are in any case disturbed, then we can see the different health issues, like hormonal cycles can be changed, uterine cycle can be changed, or PCOD, PCOS, infertility. These are the major things we see in this phase of the life in the woman. And stages of the healthy menstrual cycle, how we can explain this thing and see this thing. uh, Ovulation cycle, every month, woman has to undergo different hormonal changes, and it is a rhythmic pattern. And every month that pattern or that cycle, hormonal cycle, is in a rhythm, it is working, and every month there is a menstrual cycle. So it's the ovulation cycle when ovulation is proper, and uterine cycle when actual bleeding happens. So when it is uh, all these phases are the require more nutrition, because uh, if the follicle uh, is getting released from the ovary, and if it is embedded in the uterine membrane wall, then it needs the nourishment to have a zygote as a baby. So it's a phase every month happens. If it doesn't happen, then it shades as a menstrual bleeding. So this is the nourishment, and then excretion from the, if it doesn't have a, then the bleeding as excretion. So this we have to have the balance, and naturally. If not, then what happens? Now, what and current era, what we are doing. So this uterine lining and rejuvenation of nourishment to the uterus, uh, every month it is getting ready and it is getting shaded. So repair and restoration happens every month. So as per Ayurveda, we need to focus on the diet, mainly food items, what we are eating, and lifestyle, uh, and our mental health, because our mind is also, stress factor is also one responsible factor for uh, imbalance in this particular system. So what we mostly in our current era used as a OCP pills or IODs, intrauterine devices, and other measures are used for um, menstrual cycles, and to comfort themselves, and use of that. for the prolonged period hampers then the ovulation, maybe ovulation cycle, and then leads to different health issues. So what we are seeing majorly nowadays, PCOD, PCOS, and infertility, that may be the one of the reason for that. Uh, and sedentary lifestyle is the another factor, which, as per the research, they have seen. So what it is like? What is a PCOD and PCOS mainly? How we can define it? Like PCOD, when we say the PCOS, it is a polycystic ovary syndrome, and when we say PCOD, it is a polycystic ovary disease. So when there is a syndrome, polycystic ovary syndrome, the follicle fails to release the ovum eggs, and endocrine system is involved in this condition. It's a metabolic disorder, genetic, also genetic factor is involved. That is why it is difficult to correct this syndrome and leads to infertility. So when we say the PCOD, the PCOD is a disease like polycystic ovary disease. The many eggs are released and they form cyst because they are not expelled out and they form a cyst in ovaries. And this is a correctable disorder uh, uh, as it is related to lifestyle. So sedentary life, if it is a sedentary life or any other factors are involved, it could be corrected. But the polycystic ovary syndrome is difficult to correct. And both of the things are having the conditions like irregular menses, irregular period, then hirsutism, because of the androgen, increase androgen levels, weight gain. So this could be seen this in PCOD and PCOS conditions, and these are major things for leading to the infertility. So this is a responsible. Our factor is our lifestyle majorly, as Ayurveda has emphasized on the lifestyle itself. So it's a kapha imbalance. Weight gain happens more. Water retention is there. Metabolic metabolism is also involved. Like sluggish metabolism is there. So uh, most of the time you can see the particular kind of uh, symptoms on the PCOD, PCOS women. Like they are having more majorly the over side of the weight gain side. So cyst formation in the ovaries happens, and if it is a PCOD, as I have already said, that PCOD is a correct could be corrected, and we are talking about the PCOD here because PCOS is a little bit difficult, and we are not talking as a general term, generalized recommendations. So I'm not giving any recommendation for PCOS, but this could be used as a general uh, remedy or recommendation, herbal recommendation. So aloe vera and fenugreek seeds works wonder in this condition. Fenugreek tea could be prepared in the morning. For that, you can soak the teaspoon of fenugreek in the warm water in the night, and in the morning you can drink that water and chew the seeds. Then uh, aloe vera juice without having preservatives, that also could be used for the PCOD. Uh, Triphala is also another one herb. Like there are three herbs together, uh, Avla, Hirra, and Behra. So that could be used for if you are having sluggish digestion and having constipation kind of symptoms. That could be used, and it is also very good for that condition. What we can recommend for lifestyle means it is a lifestyle related factor. When you are having a sedentary lifestyle, then definitely you have to work on your lifestyle. That means you have to move your body and exercise. Any form of exercise you can use as a gym exercise, or walking, or hill climbing, anything, swimming, whatever is suitable for you. But especially Ayurveda recommends yoga, pranayama, and meditation, like becoming aware of your day-to-day lifestyle. That is the main thing, becoming aware. If you're not becoming aware what you are doing it, then uh, of no use of whatever medicines you are taking and not following your lifestyle or not correcting your lifestyle. So correcting and following the routine is a very uh, important practices here. uh, and diet, I will not give the list of the diet here because Ayurveda has given a very long list of the food items, but only the things which are the dairy food items like milk products, dairy items could be avoided, and the grains, wheat could be avoided because it is kapha increasing factor and we don't want kapha to be increased. So we can replace this along with the millets uh, and the maybe vegan milk could be used if you are very much uh, milk loving person. Then yes, that could be replaced with the vegan milk. And of course, the easy to digest food should be followed as per the Ayurveda. That is a thumb rule in Ayurveda. What other measures Ayurveda has recommended is a basti, a medicated enema. So this in India we usually advise. I know other countries it is not possible, but you can think about having a triphala instead of this, and it is a bit uh, recommended to uh, to take care of your weight gain problem. We need to follow all the factors which are helping to reduce the weight. So majorly exercise, diet, and then some supplements. This is the thumb rule you can follow. So exercise has a major role in that. How it is like, because all our systems like sympathetic and parasympathetic nervous system should be in the balance, because it is somewhere there is an imbalance, and that is why maybe some of the other endocrine system glands are giving this like HPO, like hypothalamus, pituitary and ovarian axis, or maybe HPA axis, like hypothalamus, pituitary and adrenaline axis, when there is a lot of stress. And especially in reproductive age, we have seen that multitasking women always under the stress. So these two axes should be taken care of, and how yoga wonderfully works because of it is working on these two axes uh, as a anuloma viloma. It is alternate nose breathing pranayama, and it is very good for your all these hormonal imbalances, along with the asana, different type of asanas, and meditation. So now let's talk about the third last phase of the. We cannot say last. We should not. We should never say that. But it is a menopause, whether it is a boon or the curse, because many women feel that all every month menstruation is a curse. They find it very difficult to manage because different conditions and problems. And when they are towards the menopause, they feel that it is a very good because they would be having menstruate every month. But then again there are some other pros and cons of this condition as well, but it is a natural condition in our woman body, and it is inevitable. Everybody has to undergo menopause. So pausing things, our body also needs a pause. We are continuously on this roller coaster of the hormonal changes throughout the life, and body is continuously on the flight and fight mode. And that system needs some kind of rest. So this is a resting phase. That doesn't mean that womanhood is gone or you are losing your womanhood. Everything is intact, but it is a natural. So if you follow the nature, nature will, it will be boon for you to maintain your health. So this is how Ayurveda and yoga always think about. So what happens, in every month, as I said, taking pause from this uh, ovarian cycle and uterine cycle. So, fertilizing egg. So, and the shading of the uterine lining every month. So that is taking pause in this menopause period. And otherwise, if I imagine if this phase is not there, what will happen to the woman's body? Continuously till the end she will be a like machine, baby making machine. So nature has already taken care of that, thinking about the femininity and fragility of the femininity. So this is a wonderful phase. Everybody has to enjoy this phase of the life also, provided if you are taking care of your health prior to menopause, that means you're in your reproductive age. And reproductive age is such an age when we are in the full energy and we forget the nature, and we go try to go against the nature for our self desires and fulfilling our desires, life desires, career desires, and all things. And we forget that nature and natural rhythm of the body. Then you will have problems in menopause. Otherwise, menopause will be the very blissful period of your life. So your preparation starts prior to menopause. That is a main thumb rule to be remembered, ladies. So there are the factors like perimenopause, postmenopause, and what should be our lifestyle, and what Ayurveda and yoga has given the recommendation to make this phase more comfortable. So changes happen in our body because hot flushes in perimenopause. Everybody, most those who have gone through this phase know that what are the hot flushes, weight gain, irregular menses, more pitta dominance is there in this perimenopause phase. So we have to think about the pitta pacifying diet in that case, like which food which will not create heat in our body or acid in our body. We have to take care of that. So red meat, coffee, alcohol, cigarette, cold beverages, spicy food, fast food items, where vinegar is used specially. Uh, then all these, all these food items increases pitta, so we should be careful about when we are consuming these food items. So we have to avoid these food items if you are especially having a lot of hot flushes problem. So include more easy to digest food like vegetarian diets of fruits, salads, and lean meat, fish, cucumber salads, and healthy fat like olive oil, sunflower oil, coconut oil. Coconut is a very good pitta pacifier, so you can use coconut oil, coconut water, and coconut itself in your preparations. Like coconut milk also can be used as a milk in some food preparation. So this food changes can be done. I'm not giving a list of the food items. It is actually describes so many food items, but these few things you can keep in your mind when you're thinking about it, because weight gain is another issue. And when we say the omega-3 fatty acids and a good sources of omega-3 is come from the particular oils like olive oil and coconut oil. Ghee in India, we recommend ghee as well because it is not consumed in a uh, fried manner, so it is good to consume. So what we can recommend in this, like herbs, like sorry. So we can recommend fenugreek seeds, tea, aloe vera, shatavari, um, like fennel seed and coriander seed tea, licorice tea. This could be recommended during the menopause period. So shatavari is a asparagus racinosis, and it is available nowadays everywhere around the world in a capsule form or in powder form. It can be used easily. It can, and it is available also. Then restlessness, sleeplessness is another problem because of the hot flushes, and uh, it aggravates restlessness in our mind also. So for the relaxation, we can think about having a brahmi or therapy like shirodhara, pouring of the particular oil on the forehead and coconut water on the forehead uh, for this perimenopause hot flushes problem. So follow the routine, because we are going to the vata predominant phase of the our life period. So the anything irregular will aggravate vata. So follow all the routine, and it will take care of all your most of the health problems. So diet, light exercise, regularly yoga, pranayama, meditation could be followed, and sleep is a main thing. Follow the sleep patterns. The postmenopause, what we can think about the complete cessation of the ovulation cycle, uterine cycle, more vata dominance, more degeneration, hence osteoarthritis kind of problems happen. Weight gain, sleeplessness, osteoporosis, dryness of the skin, dryness of the vagina. So need to focus more of prakriti is vata dominant, and if your prakriti is also vata, then you need to avoid certain things like which are vata aggravating factors from your food and lifestyle. So whatever irregularity, you have how to make it regular, eating food at the regular timings, and including oils and fluids, ghee in your diet, nuts and seeds, millets instead of wheat and corn. Take care of gut health by using the mm, um, yogurt and uh, all other fermented kimchi or pickles are also very good for gut microbiota. You can use sesame oil, olive oil, sunflower oil internally and externally on the body as a massage, and steam bath could be very helpful in this condition in the postmenopausal phase. In turmeric, shatavari, that is asparagus, ashwagandha, that is Vitania somnifera, and fenugreek seeds are very good for postmenopausal phase as well, to as a maintenance phase of the hormones instead of having the I cannot say it is a replacement hormone replacement therapy, but it is very good for postmenopausal some health issues. And pranayama, especially anuloma viloma, that is a nadi shuddhi pranayama, brahmari pranayama, shitali shitkari, ujjayi, they are working wonders. And few asanas, those which can be done as per your body permits, as per that simple asanas like vakrasana or maybe bhujangasana. This kind of simple asanas could be done, which covers all your body postures like. And of course meditation, it's a very important thing to follow in your menopausal phase of the life. The journey becomes very easy and very comfortable if you do meditation every day, at least for 20 minutes. If you are very busy, then you should sit for an hour. This is the old Zen saying. That means you have to do some meditation or whatever form of meditation, mindfulness, without fail every day as a routine. So this is how our all the womanhood phase of life in three phases could be comfortable if we follow Ayurveda and yoga as our day-to-day lifestyle, and we adapt as a habit uh, all these simple remedies and yoga recommendations in our life, and make our life more comfortable. So we can say the add life to years and not just years to lives. So just adding years to life is like, any having more health issues and you're still pulling on your life. But adding life to yours means you are fully enjoying your life. You are living your best life, and enjoying it to the fullest. Uh, and this womanhood journey is a making very comfortable and enjoyable journey. So this is how we can say that Ayurveda and yoga as a lifestyle could be used in current era for the womanhood. And these are the references which I took from the various research articles and uh, some research papers and the books, Sanskrit manuscripts and all that. If you want to contact me, you can contact me on my mobile or email address. Thank you so much for patient listening. Thank you, everyone.
Hey, it was indeed a treat to listen to your good self on the presentation today, and probably there seems to be some issue with the laptop. So, uh, yeah, now it's fine. Thank you.
Yeah, yeah.
The
Thank you
technology,
so much for
technology
connecting me.
is a blessings as well as sometimes it poses the challenges too. But we all are passing through the phase of evolving ourselves, and yeah, it was indeed a treat to listen to your presentation. It is very well articulated, doctor, and I'm a firm believer of so. Before we engage in the further conversation, I would like to ask you a couple of questions. That what is the most appropriate way of contacting you, doctor?
You can contact me on my email address. I have already
Yeah,
mentioned it.
dear
My
viewers, this is the name of the clinic and the website she is having. She operates from India. Ayur Ayur Mantra is the name of the clinic, and this is her email address. Can you spell it a bit louder and phonetically, doctor? If you do not mind, please.
Ayur,
Hmm.
Ayur, Mantra, Mantra.
Okay.
This is the name of my clinic.
Hmm.
So Ayur Mantra.
Hmm.
And my email address would be Sunita, Sunita Chaudhary, Chaudhari, numerical 3 @gmail.com.
Oh, wonderful. So, viewers,
Contact me.
please contact her directly on her given address and the website. Uh, she raised very valid points, and I'm a firm believer that if the intuition would have been drawn from the Vedantas, probably taxpayers' monies would have been saved all across the globe. And she cited the reference of circadian rhythm. If Michael and Tim, who got the Nobel Prize in 2016, if I'm not mistaken, then if they would have drawn the inspiration from the Ayurvedic texts and Vedanta, probably uh, the economic resources allocated to the particular concept for the research work would have been a different story. Same is the situation with autophagy, when Japanese scientists got the Nobel Prize, and in recently we came across microtranscription of RNA. Uh, on 7th of October, there was another announcement of the Nobel Prize in Medicine and Physiology to the Victorian team in US. We do not dispute what they try to accomplish and what they brought to the table. But if any Ayurvedic scholar can scientifically elucidate the way she is elucidating, then Prakriti Chikitsa is nothing but micro mRNA transcription. That the Prakriti of the individual is is all that we should look into the differential diagnosis, and they derive the same concept. So what I believe is instead of being in a defensive route to defend something what great sagas wrote without any financial gain or without any kind of patent applications, sort of thing, we should try to explore the wisdom from old Ayurvedic textbook, and that will allow that will empower the science, that will embolden the science, and the follower of the science, and that will help to offer a better recovery rate to the patients. I was talking to Dr. Sunita on off the camera that we came across a very good clinical finding, doctor, that I shared with you. If Malasan would not have been given by the Ayurvedic sagas, probably India would not have got three times lesser rate of colon and rectal cancer than that of China and other developed and developing countries across the globe, as numbers are quoted not by any Ayurvedic institution but by World Health Organization. So Ayurveda has offered a lot to the mankind for last 2000 years, and continue to offer better than the best to the mankind. We should look in Ayurveda as a science, as a source of inspiration, and that can definitely give um, advantage to the people suffering across the globe. Dr. Sunita, today is a very auspicious day of my life as well, when my late father was cremated way back in 1995 on a Happy New Year day. And I have a special thanks to you and to your family for allocating time for the NPFINC viewers and giving us time to make a presentation, to make them heard, and to glorify, because my father was deeply attached to Ayurvedic science. That's how I went to the Ayurvedic institution way back in 1987. Of course, I did not practice Ayurvedic medicine, is a different story. But my belief, my conviction for Ayurveda stays as it was during that time when I was with my father. Father heavenly watches us even today, and his blessings has given such a good opportunity to give a presentation on the Happy New Year Day of Hindu calendar. Dr. Sunita, do you have any message to the audience here at NPFINC? I saw your website that you undertake the classes, you coach the people. How do you manage all this during your schedule, and what are the ways, if somebody wants to learn from the western part of the world, how and what way can they reach to you at Pune? You are in Pune, right?
Yeah.
Okay.
I'm placed in Pune, India, and I do conduct Ayurveda courses, teaching courses on Ayurveda and yoga as well. And they can reach out to me on my website, my email address, uh, and my mobile number as well. I think I have mentioned somewhere in my
Yeah, it's
presentation.
being displayed during course of
Yeah,
presentation and
and it
in
is
the
always
lower
given.
bar of the presentation.
Yeah,
Even if you do not mind, will you please spell your phone number to the audience of NPF Fancy so they can contact you, please?
yeah, it is 91 country code, and mobile number is 98500 60068.
Yeah, and
Yeah.
when we were studying, when we were reviewing your profile, it seems that you are a global traveler. So, for our audience, would you be able to share which countries did you go to and what kind of activities did you undertake, please?
Okay, that's. I'll try to come into the nutshell. I visited Israel, Tel Aviv University to
Oh,
teach
wonderful.
Ayurveda
Hmm.
from basic to advanced Ayurveda course, and the teaching students used to come to India as well. And now afterwards, I visited Germany. Then I've visited France to teach Ayurveda. This is the three destination, but now Israel I have stopped, but France and Germany uh, and Brazil I have not visited, but Brazilian students do come to Pune to our center to learn Ayurveda
Oh, wonderful. That's
from
the best
US.
way. Yeah. Do they need
Yeah,
to approach you in a group, or you can take individual students as well? How do you recommend? Do they, because in order to appreciate your endeavors. Do they have to contact you in a group, or can they fly down there individually?
We have both the facilities. If somebody wants to come individually, they can also come. And as a group, the group from US already is been visiting us. Like I am saying us because it's not only me, it's few of my other friends, Ayurvedic doctors. We teach Ayurveda because it is a complete course on Ayurveda, like basic and advanced. Uh, and then Panchakarma therapy. Any different courses are also there. Ayurvedic diet and nutrition, Garbha Sanskar. It is also there. Like in during the uh, pregnancy, we recommend few regimen that is called Garbha Sanskar. So that also we are teaching in India, and mostly online nowadays. After the pandemic, during the pandemic, we did started doing all our courses online, and once they want to visit, they can visit India.
Wonderful. Very impressive presentation, doctor. And the beauty of your presentation was that you did not try to defend Ayurvedic medicine. Everything is healthcare, whether it is allopathic, homeopathic, patient, or Ayurvedic pathy. Everything is a patient pathy. No science ever teaches to put the patient to the illness. Every science try to give that better than the best. I was reviewing a publication of the National Geography. They released a beautiful encyclopedia by making compilation of more than 22 alternative medicines across the globe. And in Amazon, in the in a deep jungle of Amazon, people live, and those references are available on Google. I stand corrected if I'm incorrect, but people may feel free to visit. That there is no gynecologist, there is no surgeon, there is no neurologist, there is no neurosurgeon, no neurophysician. Even if the lifespan is probably one of the longest in the world, and they have their way of treating and healing the patients. That's known as Amazon therapy. And sitting there in the Amazon jungle, they consider that Amazon therapy is the best in the world. Same like we Indian consider Ayurveda is one of the best in the world. Same like Germans consider one of the best in the world. But what by forgetting all the difference of opinions, we are not in a phase of uh, proving holier than the thou. We try to find out what is best for the patients and what is best to the mankind. And a part of that endeavor, we did try to invite Dr. Sunita Chaudhari. She gave a beautiful presentation to all of us today on the day of happy Indian Happy New Year. She made my day. She made the day for all across the network of NPAFInc. Dear friends, we have 4K equipped video transmission infrastructure operating here at St. John's, Canada. We try to promote all kind of concept by bringing faculty through NDI route. We are non-Zoom, non-WebEx, non-GoToMeeting kind uh, of a, of a conference infrastructure that offers the best resolution and the voiceover of the present time. We invite everyone to, if you want to make your voice heard uh, through the genuine concept in a presentation, feel free to contact us. The presentations are in public domain. If you feel that you can make equal or better presentation to like Dr. Sunita Chaudhary, I assure you that you have a chance to make a presentation and and to make your voice heard here at Canada and North America. NPFINC has a global reach. You can go to LinkedIn Live. More than 40,000 viewers get the prompt when we go online. So we are very proud of our critical mass. We do not go after the client and customer by sharing, by tagging kind of a things. We do tag to only to our primary context, not beyond to that. And those who are not Facebook subscriber, they can go to Twitch. The presentation is going live at the moment on Twitch TV for last 1 hour and 15 minutes or so. So thank you so very much for your time today, Dr. Sunita. We were truly blessed and honored. Your presentation will stay on our network for days, months, and years to come. And we are truly honored. Do you have any last word of advice to the people or the viewers of NPF INC, Doctor?
Yeah, sure. For, even I would like to thank you for having me, and namaste again. And this is a wonderful opportunity to create awareness about Ayurveda, because that is a mission and vision of my life. So I'm doing it my single-handedly efforts. I'm not any institution or the company or big company like any private limited company doing this, but doing it on my own. So wherever there is opportunity to create any kind of authentic evidence-based Ayurveda and evidence-based yoga awareness, I always look forward to do it. So thank you for having me. Thanks.
We are truly honored. Thank you so much. And with this, I thank everyone, those who participated, those who provided the feedback. She will review the feedback. You may feel free to contact her on the given address on our website directly. And when there is any kind of a program, we will make the announcement on our social media. We do not have any group or any partnership across the globe. NPAFInc is a Canadian enterprise, and we try to bring in stream to assist the Canadian citizens to attain the better healthcare. Thank you so very much today.